Drug Awareness Part 3. Thank you, Nurse Sophie and Nurse Barbie. Good day, class. My name is Nurse Brandy, and today I will talk to you about drug awareness and the effects of substance abuse. Today we will discuss marijuana and how it affects your body. Do you know what substance abuse is? Substance abuse refers to the harmful or hazardous use of psychoactive active substances, including alcohol and illicit drugs, or an overindulgence in or dependence on an addictive substance, especially alcohol or drugs. In Healthy People 2020, the initiative is to increase the proportion of adolescents never using substance. Did you know that according to the National Survey on Drug Use and Health, that between the ages of 12 to 17, more teens trying to abuse marijuana? What is marijuana? Marijuana is a dry, shredded green and brown mix of leaves, flowers, stems, and seeds from the hemp plant Cannabis sativa. In the more concentrated, continuous form, it is also called hashish, and in the sticky black liquid is called hash oil. The main psychoactive, which is a mind-altering chemical, in marijuana is called THC. Marijuana also affects brain development. When marijuana users begin using as teenagers, the drug may reduce thinking, memory, and learning functions and affect how the brain connects between those areas necessary for these functions. People who started smoking marijuana heavily in their teens had an ongoing cannabis use disorder, lost an average of 8 IQ points between the ages of 13 and 38. The lost mental abilities did not fully return in those who quit marijuana as adults. The effects of marijuana. Long-term marijuana users trying to quit report withdrawal symptoms that make quitting very difficult. These include grouchiness, sleeplessness, decreased appetite, anxiety, and craving. Long-term marijuana use has been linked to mental illness in some users, such as temporary hallucinations, temporary paranoia, as well as worsening symptoms in patients with schizophrenia. The effects of marijuana include problems with memory and learning, distorted perception, sight, sound, touch, and time, loss of motor coordination, trouble with thinking and problem solving, as well as increased heart rate and anxiety. This graph is showing the use of marijuana with 12-year-olds, and is showing that it had increased by 8% in the year 2013. Now, don't be mistaken by the friendly packaging of synthetic marijuana. It is actually worse than using illegal marijuana. The American Association of Poison Control reports at least 2,700 individuals have fallen ill from the synthetic drug during the first 3 months of 2011. That is compared to 3,200 in all of 2010. Synthetic drugs that are abused by so many are man-made and produced in labs by mixing different toxic and dangerous chemicals together. Most of the time when drugs are synthetically produced in labs, many dangerous and serious unsafe chemical compounds are combined together and drug users don't even know what's in them. The behavioral signs of teen drug abuse. It could be extreme changes in social groups or friends, unaccounted time away from home or school, losing interest in appearance, sports, or social activities, sudden mood or personality changes, and borrowing money or sudden influx in cash. We are going to be positive role models, and we're not going to let drugs take control. my presentation. Now you guys should be able to demonstrate how to read drug labels and know the concepts related to common over-the-counter medications, as well as poison control, prevention, and treatment. Do you think that you can name some of the withdrawal symptoms of marijuana?